Welcome to the 2020 Spring Expo. My name is Dori McClure, and alongside my fellow group members Alfredo, Ginger, and Luke, you will learn how we are optimizing volunteer experience in a nursing home setting through the Bridge Buddies system. We are members of the student organization known as Building Bridges, which serves to combat social isolation within nursing homes in the Birmingham community. Social isolation is a problem that faces people at any age, but it especially plagues those who live in a nursing home facility. This form of isolation occurs when a person has little to no communication with another individual, and as a result, it can negatively impact physical and mental health. So it is our goal to volunteer with the residents of nursing homes to provide them with the social interaction they need in order to increase their overall well-being. Since becoming members of Building Bridges, we have come to the realization that some students have an apprehension to volunteering at a nursing home, and there are some issues with volunteer retention at South Health and Rehabilitation. With that in mind, we had the idea of reinforcing the experience for volunteers by implementing a smoother orientation process and creating the Bridge Buddy system. We created the Bridge Buddy system because we believed that pairing two student volunteers together would hold them more accountable to volunteer at the facility. Both of these methods were put in place to improve volunteer retention so that we could focus on our organization's main goal, improving the well-being of the elderly. As you can see, we kept track of our project using a timeline. Our group first formed in January of 2019, and this is when the planning stage of our project began. During the first few months of 2019, we spoke with the former president of Building Bridges in order to identify ways we could improve the organization. It was during this time that we realized the organization was in need of changes that could reduce student apprehension of volunteering at a nursing home. So in May, we revamped the social media in order to recruit more students, and we began volunteering regularly as a group in July. After having an executive council meeting in August, we planned on doing more advertisement of our organization. So we tabled at Connect Fest and then held an interest session. Going into 2020, we continued our efforts to gain volunteers by participating in Succulents for Seniors, and we held another interest meeting. Succulents for Seniors was a collaborative event with Green Initiative and Active Minds, where we brought succulents and Valentine's Day cards to the seniors at South Health and Rehabilitation. This event really helped us gain traction and allowed us to acquire some more volunteers. As a result, we sent out our preliminary surveys in March and began to implement the Bridge Buddy system.
Another strategy we did to gain more volunteers was to change the volunteer application selection and training process. One of the things that we did was incorporated the training in the interest session to eliminate the various steps in order to become a new volunteers in hope to get more new volunteers more quickly. Regarding the Bridge Buddy systems, our methods for data collection consisted of surveys that we gave to volunteers to record their personal apprehensions while volunteering at the nursing home and to identify a trend whether they had more comfort while volunteering by themselves versus with other volunteers, and this helped us provide a rationale for implementing our Bridge Buddy system.
As shown by the results, the largest number of students indicated that they felt more comfortable volunteering around seniors with a group of their peers as opposed to volunteering alone. Since the largest number of students indicated that they would rank their comfort level a 4 when volunteering around seniors alone, as opposed to the largest number of students ranking their comfort level a 7 when volunteering with their peers. Students also indicated they were likely to volunteer more often if volunteering in a group of their peers as opposed to volunteering alone, as the largest number of students indicated that they were likely to volunteer 2 times per month if alone, as opposed to 4 times per month if volunteering with a group of their peers.
Even though our research and data results were somewhat interrupted by the public health crisis, COVID-19, results in our data would suggest that UAB students feel much more comfortable around seniors when accompanied by other peers. This would be shown in our results section when comparing the perceived comfort around seniors alone and perceived comfort around seniors when accompanied by other peers. These results positively correlated with the estimated frequency when volunteering alone versus volunteering with accompanied peers. Results could have been affected by students' interests, academic paths, schedules, and access to the facility. Even though our data may suggest that students feel much more comfortable when accompanied by peers to South Health and Rehabilitation, in order for the Bridge Buddy system to remain afloat, it is imperative that Building Bridges has a large enough volunteer base to create a more comprehensive scheduling plan for visiting South Health and Rehabilitation. Given that our biggest turnout is seen among incoming freshmen, for example, like in the Freshman Involvement Fair or in collaborative efforts with the Green Initiative and other clubs, Building Bridges would benefit from increasing collaboration with more student organizations to bring in diverse volunteers with unique ideas.
The completion of this undertaking would not have been possible without the help of our faculty mentor, Dr. Diane Tucker, and the volunteer coordinator at South Health and Rehabilitation, Miss Annette Smith. The group would also like to express their deep appreciation to the student volunteers who participated in the surveys. Last but not least, we would like to thank Victoria Miller for assisting us with this project.